Good morning. My name is Deanna Kepka, and I'm a professor at the University of Utah. Elsa Osborne asked me to give this little video, which I'm excited to do. It's fun to talk to students who are nearing the end of their high school journey, and I'm sure you all are amazingly resilient even during these very challenging times with COVID-19. So I'm here to talk a little bit more about the work that I do and what it took to get here. So Elsa asked me to discuss these different topics. I'm going to kind of go in order and take it from there. So in terms of my education, many years ago when I was an undergraduate student, like most of you will be, I'm sure, very soon, I decided to focus on psychology and philosophy at Northwestern University outside of Chicago. And I chose these two areas because I knew it would improve my writing skills, my critical thinking skills, and my ability to design a research study. But while I was at Northwestern, I enjoyed volunteer work. I enjoyed getting out into Chicago and working in different communities. I spent a lot of time on a domestic violence project for women, and that motivated me to pursue 2 years as a Peace Corps volunteer following my undergraduate education. And I spent those 2 years in Kingston, Jamaica. And while I was there, I simultaneously worked on a master's degree with Illinois State that focused on management of nonprofit organizations. I cannot speak more highly of the experience of being a Peace Corps volunteer, living in a country where you are different because you're a minority, you're an outsider, working in partnership with a nonprofit organization that served people living with HIV and AIDS. That's what I did, and worked in an inner city community, very impoverished squatter community in Kingston to try and improve healthy lifestyle choices for kids. So I think building partnerships in the world beyond the world that you know teaches you so many skills that you won't learn in any other setting. And it also helps open up your eyes to what's really important in this world. And for me, it was public health. And we can all see the impact of public health, like why public health is so important during these times with COVID-19. So from there, from my time in Jamaica, I came back and worked in Chicago for about 2 years at an international nonprofit organization and another couple years at a federally qualified community health center that served the Mexican population of Chicago. And those experiences in those nonprofits also taught me about the important needs of diverse populations in the United States and some of the challenges of working to help international communities from the US. So I chose from there to go on for an MPH. And I'm sure many of you have heard Master's in Public Health. It's a really, really important degree. It's critical in the world that we live in right now, where public health crises and practices affect our entire daily life, and now more than ever, we can see how public health really preserves professionals in public health preserve the safety of an entire country and many countries across the world. If you look at folks that work for the World Health Organization, the kind of work that they're doing in public health are developing policies and programs for the whole world's most vulnerable populations and for the whole world's most large cities, big communities, small communities, just for people overall in diverse settings. And it's really using what we know about science for how to keep people healthy and safe and how to preserve human rights around free from violence, free from oppression, free from biohazards that affect your ability to live a healthy life. So I'm going on a few tangents, but let me get back into my education. So I went to University of North Carolina in Chapel Hill. I studied health behavior and health education. I spent 2 years there. I did a lot of Latino health work. I still worked in HIV and AIDS at that time. And I really enjoyed the research side to public health. So now the research side is a little bit different than just general public health work, like health department work or nonprofit organization work or working in a community health center. The research side involves testing new tools and strategies to improve public health and testing those new tools and strategies in a systematic way, in a way where we can know what works and what doesn't work. And I was fascinated by this, to be at the cutting edge of how public health programs are designed through leading new research studies that test different approaches to different public health programs. Was really exciting to me. And what also was exciting to me was working to benefit the most vulnerable patients or these most vulnerable communities in the United States and around the world. So from there, with an MPH, I went on to a PhD program, and I went to University of Washington in Seattle. I did my PhD in health services research. And again, while in Seattle, I worked with the Latino community in the Yakima Valley, which is eastern Washington. It's fairly rural. It's where a lot of our fruit comes from. There's more fruit trees, I think, per capita in the Yakima Valley, Washington than any other place in the United States. I think more diversity of fruit trees and fruit vineyards. So I originally had been working in HIV. I enjoyed prevention of sexually transmitted infections. I enjoyed working with our most stigmatized populations around the world. I spent a little bit of time in Peru while I was in Seattle doing a summer study abroad, where I worked on looking at how men who have sex with men in Lima, Peru, were handling taking antiretroviral therapy. So HIV positive men in Lima, Peru, how were they able to manage the medication load? What kind of reminders, tools, programs that we could develop to help them stay on track with adherence to their HIV/AIDS medications? And I don't know if you know, but the drug regimen used to be very, very complicated for persons living with HIV, and now we're down to just one pill a day. So that's an example of how research is helping those who are most vulnerable, making their lives a little bit easier to manage to best promote their well-being. So from my time in Seattle, I decided to transition from HIV to human papillomavirus, and that's still the work that I do now. So it's been more than 10 years, and I'm still working in human papillomavirus. I transitioned to human papillomavirus because I wanted to get behind a very widespread infection that's really common in the United States and that marginalizes persons in the United States. So human papillomavirus causes cervical cancer and 5 other different types of cancers. And in 2006, which is around the time that I was working on my dissertation in public health in Seattle, there was a vaccine that was approved for girls to prevent cervical cancer, the Gardasil vaccine. And I've been working in improving education and vaccine delivery programs ever since. So I completed my PhD at the University of Washington. I was inspired to pursue an academic position, and that's what brought me to, then I moved one more time. I know my poor husband, he has moved so many times. Then we moved to the Washington, D.C., where I did postdoctoral fellowship. So a postdoctoral fellowship is after you complete a PhD, you get 2 more years of training, typically at a different institution than where you got your PhD. So you build more connections with other investigators in your field of interest in diverse work environments. And you challenge yourself to become a leader, become your own principal investigator, to design your own research studies, to work on a team where you're in charge of what you're doing. You partner with people to work together with you to reach your goals. So it's kind of what I would call the first steps to developing an independent research program. Obviously, while you're working on your PhD, you're very much mentored, and you're part of a team, and your dissertation chair and committee really guide what you're doing. When you transition to a postdoc, it's like, now it's your turn. Now it's your turn to figure out how you're going to move ahead in your world. What gaps in the research world are you going to address? What type of research program are you going to develop? And how are you going to position that program to be competitive for grants? Because a big part of being a professor with a research focus is securing grants to pay for a portion of your salary and your team's salary. So at the National Cancer Institute, I was mentored by some of the brightest minds in the country in health services research and in cervical cancer prevention. It helped me position myself to lead my first series of papers. I think I wrote, 6 publications coming out of that postdoctoral fellowship as a lead author, and then was partner on many other papers. So that positions yourself for a competitive job as a tenure track faculty member. So I moved from Washington, D.C. I wasn't quite ready to take a professorship. I had a new baby, so I had a son, and then I had a new baby. So the nice thing about academic position is you are able, it's a very understanding position for incorporating building your own family while pursuing this field. So I had 4 years in my postdoctoral fellowship, but I left after 2 because I had a phenomenal offer to come here to University of Utah and Huntsman Cancer Institute. I knew I wanted to work at a National Cancer Institute designated cancer center. It's where the most cutting edge research happens in the United States. I had a phenomenal experience when I was at University of Washington working for the Fred Hutchinson Cancer Research Center. That's where my dissertation chair was, and that's the team that mentored me for my dissertation. So I came here to University of Utah almost 8 years ago. It's amazing, and I have absolutely loved it. I am the director and founder of the Intermountain West HPV Vaccination Coalition, and I'm happy to share ways for you to get involved in that if you're interested. And I've built a research program that is centered around improving HPV vaccine interventions, education programs, and strategies to improve the treatment and survivorship of HPV-related cancers, along with the prevention of HPV-related cancers. So the majority of my research now focuses on we have this vaccine that prevents cancer. We know if we use this vaccine, we could be preventing 33,000 cancers each year in the U.S., yet states like Utah lag behind. And we're not alone. Other states in the Mountain West lag behind, and many states in the South. But we are near the bottom in the United States for our performance on HPV vaccination. I think we're state number 42, 43. We used to be state number 49, so we're getting a little better. But if you look at 3-dose completion, because there's many doses in this vaccine, we fall even lower. So that's been my program here, is to improve cancer prevention and control programs through research that target HPV-related cancers and our most vulnerable patient populations. So I focus on Latinos, other immigrant and minority groups, and rural communities in the Mountain West. All right. So the thing about a career in academia, it's tough. It's a lot of hard work. You have to put in a lot of grants to fund your team, to fund yourself, to position yourself to be a leader in the country around your area of research. And all of this hard work leads to publications and exciting funding opportunities that really can change science, really change public health science and the way we do things. And that the early career days of an assistant professor are intense because you want to position yourself for tenure. And last summer I got tenure. I'm now an associate professor in the College of Nursing at the University of Utah. I'm a health services researcher who works in nursing, and I'm an investigator at Huntsman Cancer Institute. Furthermore, I have a global health interest. So in the College of Nursing, I'm also their director of global and international health. So that means that I improve educational opportunities for our students who also have global health interests. I improve global learning opportunities locally, so students can do work in the Wasatch Valley or in the Mountain West region that targets vulnerable patient populations with a focus on immigrants and refugees and Native Americans, Or we can work on partnering for students to have international experiences. Unfortunately, right now during the time of COVID, we're putting a hold on some of our students' international experiences, but last year we were able to send a cohort of doctorate of nursing practice students to Rwanda, which was really exciting to be able to give them that opportunity. Okay, I chose my career because hands down, I love it. Every day I love it. It is not easy, but I am so stimulated and challenged every single day. I feel that the work that I do is important. I feel that it matters. I feel that my challenging my intellect helps improve the quality of the work that I do. And that's important. It's important to be stimulated and engaged in your work. The next 10 years, my job is going to be around. I'm a professor with a public health background, focusing on health services and educating nurses. I'm going to be around. I'm definitely going to be around. It's probably going to take off even more. Some of our challenges I can see is not having enough grant funding, especially with our economy in a very, very difficult situation right now. Grants are hard to get before the economy was going downhill. And I can't imagine what grants are going to be like in the next 5 to 10 years, given our economy situation right now. Because even though most of our grants come from the federal government, that funding is depending on the tax base for the U.S. So if the U.S. isn't doing well overall, lower tax revenue, lower money going to the National Institutes of Health and then trickling down to us. Furthermore, we depend a lot on foundations to support like Huntsman Cancer Institute, to support the work that we do. And a lot of foundations and private donors provide grants that allow us to get our research going, to get pilot awards at the University of Utah or at Huntsman Cancer Institute. I am hoping that I'm able to work myself out of a job in the HPV vaccine world. I'm hoping that we will have 80% of 11 and 12-year-olds vaccinated within the next 5 years. But then my next goal will be other avenues for cancer prevention and treatment. I am interested in going back to some HIV work, looking at how we can improve cancer prevention among persons living with HIV. I just completed a project for the Utah Department of Health where I surveyed every single person with HIV in the state of Utah to look at the healthcare services that they've been receiving. Then I also surveyed persons who are at risk for HIV, so persons who use injection drugs, or persons who've had multiple sex partners, or persons who are among vulnerable communities where they may be at higher risk for HIV infection. So there's a lot of new avenues for my work. Even if I work myself out of a job in HPV vaccination, my interest in vulnerable patient populations is not going to go away, especially with the difficulties our economy is having right now, and looking at how to improve healthcare services for persons who are at risk. So some other stories about me, in this position, it's really exciting. It's a lot of work. I work probably 6 days a week, and I think I've been doing that for 7-8 years. Occasionally I'll take a weekend off, but then I need to get back on my computer on a Saturday or Sunday to keep up with my grants and papers and projects and commitments and teaching. I teach a class that starts in 2 weeks called Context for Advancing Science for nursing PhD students. And I need to find time to get that course up and going. And that course teaches nursing students about how to design research studies that are innovative and that will position them for success. So I got to go to Ghana a year ago and go out into the community and do interviews with women with a translator, and they speak 20, 30 languages in Ghana. So I needed a translator who spoke at least 5-6 languages to help me communicate with women living in the most absolute impoverished circumstances, where cervical cancer is the top 2 cancers that kill people in Ghana. It's breast and cervical. Sometimes cervical is number 1, sometimes breast is number 1. But even among men and women, breast and cervix are the top 2 cancers. They're probably not diagnosing as many cancers in men as they should be. It doesn't mean that they're not there. They're just not being detected because the healthcare system is strained. So I got to go to Ghana. I got to talk to women who make jewelry and sell it on the side of the road. I got to talk to women who live in a community without running water and flush toilets and very turbulent electricity, and hear about what their thoughts are on how to get better access to prevent cervical cancer. And typically cervical cancer is prevented with Pap testing and treatment and HPV vaccination. Well, they have very low use of all of those things. So a new strategy we're looking at is HPV self-testing, where women could self-test for HPV using something like a tampon. And then we would measure the women who had HPV, and HPV is so common, 80% of us will have it at one point in our lives. But if you have one of the oncogenic or the cancer-causing types, then that woman should be monitored and treated for precancerous lesions. So that's just an example of some of the work I got to do. I was at the Navajo Nation in Monument Valley just a few weeks ago doing a training at a community health center there. Another amazing experience. It's hard to believe that Monument Valley is in the same state as Utah when we've got persons living there without running water access, without stable housing. And because of that, we're seeing really high COVID rates in Navajo Nation. And that's just why working in health inequities is so important. If we don't give people the resources that they need to have a high quality, healthy life, then we're going to see disease have just devastate communities who are more vulnerable. And along with that, I've been traveling around the Mountain West to Colorado, Montana, Idaho, Nevada, to do work in HPV vaccination and look at strategies to improve HPV vaccination in rural clinics where they have some of the lowest vaccine rates in the Mountain West and in the United States. I love working with students. I've had a student who was from a really small rural town in Utah, Altamont, came from a really big family, and she worked with myself and my friend as a research assistant, and we just knew she had raw talent. I mean, she came from a high school where I think there was only 30 kids in her graduating class, and she just had the raw talent to be able to take off, and she won a competitive grant to pay for her education. And we're so excited that this Christmas or this holiday season, she just finished her PhD. So we started working with her when she had just completed her undergraduate degree, and now she's our friend who's a doctor who's going to work with us on projects as a co-investigator, as a faculty at another institution. And she got a prestigious postdoctoral position like the one I had at NCI in Arizona. So there was some discussion or questions around salary. I would say, with a public health degree, like a master's in public health, you can probably earn between $40,000 and $60,000 if you work your way up. With a PhD and a postdoctoral fellowship working at a university, you could be earning anywhere between $90,000 and $150,000 in your first few years. So it's a huge range of salaries. But the thing about public health is the jobs are going to be there. I think COVID-19 has really underscored the importance of public health and of strengthening our public health systems as a country and as a world. So I don't think you'd be without a job. I think there's a lot of choices in the path you choose. You can work at a state public health department and run a program, or you could pursue a research path like I have. But there are jobs there, and the salary ranges are huge. And a lot of times the salary ranges correlate with the amount of pressure there is in the position to win grants and provide for your team, to be able to hire your team, to be able to provide for your own salary, which the universities like. The universities like when you win grants that pay some of your salary. So it is competitive, it's challenging, but there's a wide range of types of positions and of time commitments that are associated with those positions. But the bottom line is you're going to feel good about what you're doing, and you're going to feel that you're making a difference. And what I love is every day is different, and every day I feel challenged, and every day I'm excited to think about what's next. What am I up to today? It's usually completely different than the day before, and how is that moving towards my greater goals, which is to improve health inequities around cancer prevention, treatment, and survivorship issues in the Mountain West and among vulnerable patient populations around the world. So I'm available if you want to talk to me, if you have any questions. I really appreciate Elsa giving me this invitation. I hope I kept you engaged this morning, and thank you so much. And if you want to join the Intermountain West HPV Vaccination Coalition, we are trying to include students to become members because we want to hear more about student perspectives on the vaccine. So thank you so much. Take care.